In considering your unlocked movement, hand dominance is a major factor when it comes to your overall function and performance. When we don't move, we actually experience more tightness, more restriction, and we get locked up. That's where the pain, the weakness, or just in general tightness or symptoms that we experience. So in this video, I want to break down more descriptions on what hand dominance has to do with your overall ability to move. So let's start with a few questions. Number one is, what patterns are you consistently going through that are keeping you locked up? Two is going to be looking at what are the actual activities, or in general, what are some life factors or lifestyle factors that are coming into play that keep us locked in? And then three is, what are we doing to counter it? So let's start with number one, what patterns are you going through? When we ask this question, we have to think out a little bit broadly sometimes, and also specifically on what activities we're doing on a daily basis versus what we've been doing over a long period of time. Let's just consider some factors. Say growing up, maybe you played certain sports, maybe you're involved in certain activities, such as, let's say, maybe a golfer that's going through a certain swing consistently, maybe someone that played baseball, or even a runner that's constantly running in the same plane of motion. Now let's consider some factors such as your work. Say you're sitting at a desk all day and you're kind of locked up in a certain position. Maybe you're on the phone where the net gets turned, or let's just take the case of maybe a surgeon who has to look down to a certain position during the surgery because of the way the machines are placed. So that being said, there's always different devices or just different positions that we have to get in depending on our activity and how our work environment is set up. Now, when we're considering these factors, again, we're thinking about what are we consistently doing on a daily, weekly, monthly, yearly basis that may be keeping us locked in these patterns. So start thinking about that, write this down, and say, you know, what is some maybe the positions that I'm always constantly in, or maybe the movements I'm constantly going in that's also related to your hand dominant pattern. Number two is going to be asking, you know, what is it, maybe some other factors that's keeping us locked into that position. So outside of the movement patterns, we may be looking at factors such as the nervous system. So let's break this down. There's two parts of the nervous system, sympathetic and parasympathetic. Your sympathetic is something that we call the fight or flight. That gets us activated. So we want this whenever we're working out, getting muscles activated, or just in general, we really need that response to get up and get going. But when we're looking at movement and getting the body relaxed and also opening up, we want to think about the parasympathetic. This gets us more of in a relaxed situation and a position where we can actually get our body to calm down and to open up. So those are some main factors when we're saying, you know, what are we actually considering, what are we exposed to, or maybe our day-to-day lifestyle of what's actually keeping us locked up. So some considerations now when we're thinking about that being said with the nervous system is, what's keeping you stressed? When we're stressed, we tend to be tight. When we're actually in a tight position, we experience more pain. Thus, we stay locked up more. There's a lot of factors in as far as stress goes that we could mitigate or even de-stress in a way, considering that factor. Also looking at diet, certain foods keep us tense and tight because of the way the nervous system works and how it affects the nerves. And then you think in general as far as exercise and movement to kind of de-stress. So there'll be factors we'll talk about a little bit more in depth when we talk about the parasympathetic and the sympathetic as far as how do we get our nervous system fluctuating, get the body more relaxed. But in this case, again, it's taking in considerations of what you're taking note on. It's keeping you in that position to be locked up. And third is, what are you actually doing to get out of this position? Meaning, what are you doing to strategy-wise counter it and actually get the movement of the body back into place? So we may be thinking about something such as movement exercises, which this program is really highly based around. It could be diet, exercise, things to actually de-stress the body. So just in general, what are we doing to counter that position? So if I'm constantly, for example, let's say I'm a runner, I'm an athlete, I'm constantly going through the same plane of motion, what other movement patterns are we adding into our day-to-day, week-to-week, month-to-month to break up these patterns so we just don't constantly keep working out the same muscle groups and staying locked in that same position? So when it comes to overall human function performance and your ability to move, considering the hand dominance is really a major factor. You know, this is a big player of your nervous system. And when we think about our movement patterns, we always kind of have to backtrack a little bit and say, you know, why is there pain in the first place? Is something locked up because it's not moving? Our body's very good at finding movement somewhere else. Meaning if something's not moving because it's either tight or just in general alignment's off due to gravity or just position in our body, we have these actually forces on that area that actually increases the pain we experience. Thus, it's going to try to find the movement somewhere else in the body. And if it doesn't, you know, that's where we get the extra pain because what is not moving and is trying to be forced to move does not feel good. So all these factor in, and again, the hand dominance is a major factor. You know, everyone has a tendency, even if they're left and right-handed per se, meaning they do activities both sides, the tendency is there's always going to be one rotation or just in general one position that they tend to favor, especially when it comes to more of a physical sport-like activity. So big considerations when it comes to your overall human function performance and your ability to move and get unlocked is looking at your hand dominance and which pattern that you're consistently going through.